Hello, I'm Dr. Valentin Dobolyanu. I'm a periodontist practicing in Toronto, Ontario. In this video, I will be discussing a gum grafting procedure. Our gums serve as a natural defense system that protect against both trauma as well as bacterial invasion. Cases of minor gum or gingival recession do not require any treatment, as the remaining healthy gingiva may be enough to help protect the tooth. The adoption of atraumatic brushing and flossing techniques will help prevent the recession from progressing in the future. When the recession is advanced, however, the remaining gingival tissue will no longer serve as a healthy defense system against bacterial invasion and trauma. Roots may then start to become sensitive to hot and cold foods. The exposed root surface may not only have an unsightly appearance, but it may also experience dental decay. A periodontist may offer soft tissue grafting in order to reconstruct the missing tissue and to help protect your teeth. There are two types of graft procedures. The first, the root coverage graft, also known as the connective tissue graft, is indicated when there are aesthetic or cosmetic demands, and when exposed root surfaces cause sensitivity. A root coverage graft will increase the thickness of the band of protective gingival tissue, which is the non-moving gum tissue that sits next to the tooth. In many cases, it will also help to completely reverse the recession. The procedure involves taking a thin piece of tissue from the roof of the mouth and inserting it into a pouch that is created at the recipient tooth. The root coverage graft is a highly effective and aesthetic treatment that helps to eliminate recession. The graft will also prevent the recession from reoccurring in the future, as long as patients thereafter commit to an atraumatic brushing and flossing technique. The second procedure is a gingival augmentation graft. This is also known as a free gingival graft. This procedure is indicated when recession is progressing with time and when there is discomfort during chewing or toothbrushing. It is also indicated when orthodontic treatment is planned and it is expected that a particular tooth movement may result in recession. A free gingival graft will widen the zone of protective gingival tissue. It will also deepen the vestibule and relieve muscle tension, which helps to prevent the recession from reoccurring. The free gingival graft involves taking a thin piece of tissue from the roof of the mouth and attaching it along the root surface of the recipient tooth where the gum tissue is lacking. The free gingival graft is a highly predictable treatment that helps widen the zone of protective gingival tissue around the tooth. The graft will also prevent the recession from reoccurring in the future, as long as patients thereafter commit to an atraumatic brushing and flossing technique. Both a connective tissue graft and a free gingival graft take approximately 1 hour. They may be done with local anesthetic alone or in combination with sedation. Most patients are back at work after 2 days. The majority of healing takes place during the first 2 weeks, and patients may then resume most of their normal eating and oral hygiene practices. Patients will be seen for a 1 week, 2 week, and 4 week post-operative check. For more information on the causes and treatment for gingival recession, please visit the following online link to an article published in Oral Health, one of our national dental journals. Thank you.